Hi everyone. Very good afternoon. So today I am here with one more task of OET writing. So before moving further, firstly I would like to discuss with you some important facts in OET writing. So let's discuss first. Okay. Let's begin with key facts. So the test is comprised of the one task specific to each profession. As I mentioned you in the last video, कि जो आपका OET task है हर एक profession specific रहता है, and the task is to write a formal letter on the medical matter which is relevant to the reader using a set of the case notes and stimulus, and the test lasts for 45 minutes, which includes 5 minutes reading time and 40 minute writing time. So in given 5 minute reading time, firstly we need to understand the case note provided in the task booklet, which explain the patient background and condition. So the task instruction are provided at the end of case note. During this time, no writing is permitted, as I mentioned in your previous video. So initial जो आपका 5 minute time होगा reading time, वो 5 minute time आपको completely spend करना है in the reading the context of case note, or even during this time they will not allow you to write anything on your paper. Then next we have the answer format. So in OET, OET is mainly your paper based and computer based, even OET is at the OET at home based. So firstly we'll discuss OET on paper based. So what will be the answer format for OET on paper based? First, so point number first, candidate use pencil or pen to write their letter in the answer booklet, so they can refer to the task booklet throughout the test. इवन अब कैंडिडेट है वो पेंसिल की हेल्प से भी और पेन की हेल्प से भी अपना टास्क स्टार्ट कर सकता है अपनी आंसर बुकलेट में, और ड्यूरिंग राइटिंग टास्क इवन ही और शी कैन रेफर टू द बुकलेट थ्रू आउट द टेस्ट. एंड सेकेंड पॉइंट, वंस द राइटिंग टाइम स्टार्ट, कैंडिडेट कैन सर्कल और अंडरलाइन द केस नोट. इवन राइटिंग टाइम पे कैंडिडेट जो है जो भी इम्पोर्टेंट इंस्ट्रक्शंस हैं, इम्पोर्टेंट जो भी उसमें आपको कंटेंट लग रहा है एज पर द OET task, so even you can underline and circle the important instruction. Then third, if candidate wish to draft, they should use the blank page provided in the answer booklet as well. And the fourth point, appropriate spacing and layout is required to follow the formal letter convention. So जो भी आप अपना आंसर फॉर्मेट है और जो आंसर बुकलेट पे जो भी आप इंफॉर्मेशन लिख रहे हैं, तो उसका एक प्रॉपर स्पेसिंग और एक प्रॉपर लेआउट होना चाहिए एज पर OET टास्क. Then next, moving further, OET or computer and OET at home. So in case कोई student अगर OET on computer and OET at home मोड के अकॉर्डिंग एग्ज़ाम देना चाहता है, तो उसके अकॉर्डिंग जो आपका राइटिंग फॉर्मेट है इज बिट डिफरेंट. So candidate type their text in the text box provided on the split screen, and which also allow the case note to be visible throughout the text. क्योंकि जब भी आप कैंडिडेट कंप्यूटर बेस्ड एग्जाम दे रहा है तो थ्रू आउट द टास्क इवन ही और शी कैन easily go through that. And once the writing time start, candidate can use the mouse to highlight the case note. Same in case of your writing task as well in your paper based exam, कि लाइक इन पेपर बेस्ड एग्जाम जैसे आप पेंसिल्स के साथ सर्कल कर सकते हो इंपॉर्टेंट इन्फॉर्मेशन, वैसे ही आप कंप्यूटर एग्जाम में माउस की हेल्प के साथ जो इंपॉर्टेंट इन्फॉर्मेशन है यू कैन हाईलाइट. If candidate wish to draft, they should do so at the top of the text box and delete this before submitting their response. But इन केस अगर कोई कैंडिडेट अपना एक काइंड ऑफ एक रफ वर्क करना चाहता है, ही कैन और शी कैन, बट सबमिट करने से पहले उसको उस टेक्स्ट ब्लॉक को डिलीट करना होगा. एंड द फोर्थ वन, द फंक्शन सच एज कॉपी एंड पेस्ट आर डिसेबल्ड. सो कॉपी एंड पेस्ट जो मोड है वो डिसेबल्ड है कंप्यूटर और होम एट OET में. सो नेक्स्ट टॉपिक जो हम डिस्कस करेंगे, द स्कोरिंग एंड असेसमेंट क्राइटेरिया. So the candidate performance is scored against the 6 criteria, or even answers are double marked by the OET trained assessors. So mostly two trained जो assessor है वो exam को check करते हैं. So the what are the criteria next, like first purpose, then the second content, and third is conciseness and clarity, fourth is journal and style, and the fifth is organization, and sixth is language. So each criteria is assigned a band score from 0 to 7 except purpose, because which has a band score 0 to 3. So so purpose के लिए जो एक band score है वो 0 to 3. Then pass grade: to achieve a 350 score, candidates should aim to consistently score band 5 or higher in content, conciseness and clarity, journal and style, और even organization और layout में at least 5 और इससे ज़्यादा score करना पड़ेगा. But in case of purpose, at least out of 3, 2 bands needs to score so that candidate can get 350 marks in exam. So what are the skills tested in your OET writing task? So the following skills are tested in the writing task. First, writing clearly. और mainly your writing should be legible, acceptable writing होनी चाहिए, writing clearly, concisely and accurately using the case notes, और जो relevant होनी चाहिए. ठीक है, जिस भी इंटेंशन से आप लेटर लिख रहे हो रीडर के लिए वो रेलेवेंट इंफॉर्मेशन होनी चाहिए. एंड द सेकेंड वन, सिलेक्टिंग, ऑर्गेनाइजिंग एंड प्रायोरिटाइजिंग द इंफॉर्मेशन इन द क्लियर लॉजिकल पैराग्राफ यूजिंग द अप्रोप्रिएट फॉर्मल लेटर राइटिंग, लेआउट और कन्वेक्शन. देन स्किल नंबर थर्ड, यूजिंग द लैंग्वेज अप्रोप्रिएटली. फ्लेक्सिबिलिटी है, एक्यूरेसी है फॉर द रजिस्टर, फॉर द हेल्थ केयर रजिस्टर, विच आर द फंडामेंटल टू अचीविंग द क्वालिटी राइटिंग कम्युनिकेशन, लाइक procedure was performed, conducted, examination was performed. So like in this way we can use. And making clear and polite request, summarizing the information, presenting a clear timeline of the events, and the formal letter writing convection should be there, and making a good first impression. So your layout also plays very important role. तो आपका एक layout और आपकी जो writing है वो clear होनी चाहिए. Skill number first, making clear and polite requests. So whatever the type of letter healthcare professional are being asked to write, it is essential that the reader understand the basic request that is being made of them. So जो अभी आपका writing task है, so it should be clear कि to whom you are writing letter. It should be clear. So therefore the clarity and positioning of the request are very important. After reading the background of the patient situation, it is natural for the reader to search for the key phrases, like which will signpost a request for the further information. For example, like please, kindly, would you, it is important to, Mr. XYZ requires. So it is possible there will be a multiple request in timeline the latter. So with differing level of urgency. So in a busy healthcare setting, the reader will be scanning such a text, expecting the request to be the clear and concise. So जो भी आपकी लेटर राइटिंग है, कंटेंट सिलेक्शन है, वो उस बेसिस पे ही होनी चाहिए कि लाइक टू whom you are writing letter, so another health care professional may be he or she be busy. So उसके अकॉर्डिंग आपको जो इम्पोर्टेंट इंफॉर्मेशन है इट शुड बी ऑर्गेनाइज प्रॉपरली. सो दूसरा जो रीडर पर्सन होगा डेफिनेटली एक्सपेक्टिंग दैट कि जो रिक्वेस्ट है एवरीथिंग शुड बी क्लियर एंड कंसाइज एंड एक्यूरेट. So student may need support to express their request using the suitable polite language, and avoid obsequiousness like means overly obedience. वो सब चीज़ें भी avoid करनी है that isn't valued in the healthcare writing in the especially your English speaking workplaces. Skill to summarizing information. The ability to summarize or paraphrase information is an effective information and is an effective tool in both spoken and written communication. So this skill requires strong analytical and the critical thinking ability as well as the good reading and comprehension skills. So summarization plays very important role, and candidates are assessed on their ability to omit unnecessary information, because no need to write each and everything. We need to specify the information, or even we can eliminate some unnecessary information so that the latter is an effective summary for the reader. ठीक है, बिकॉज नो नीड टू राइट ईच एंड एवरीथिंग. मे बी हो सकता है जो आपको लेटर राइटिंग है वो काफ़ी लेंथी टास्क हो, मे बी एक शॉर्ट टास्क हो, इज एंटायरली डिपेंड ऑन योर फाइनल एग्जाम. बट योर समरी शुड बी क्लियर, it should be effective and clear, and this is scored in the conciseness and clarity section of the making criteria. Like as I have mentioned earlier, like जो आपका एक असेसमेंट क्राइटेरिया है, कंसाइसनेस और क्लैरिटी। तो समरी और समराइजेशन और जो भी आपकी कॉम्प्रीहेंशन स्किल्स हैं वो इस इंफॉर्मेशन से आपका जो असेसर है वो असेस करेगा। Skill number third, presenting a clear timeline of events. So presenting a clear timeline of event in the OET writing task of events in the OET writing task is important for ensuring the clarity, accuracy and comprehension by the reader. So it helps the reader follow the sequence of event easily and understand the content and progression of the situation. Maybe in your letter multiple dates they have given, maybe maybe a few dates they have mentioned. Okay, so skill number third, presenting a clear timeline of event. So presenting a clear timeline of event in the OET writing task of the event in the OET writing task is important for ensuring the clarity, accuracy and comprehension by the reader. So if it helps the reader follow the sequence of events easily and understand the context and progression of the situation. Maybe in final exam, if you will get the case note with the multiple dates, so now it's your responsibility as a healthcare professional how you will organize these dates. Maybe few dates like they have given in March month, in a March or April or May month. So in case if patient having some follow up visit, like patient firstly visited maybe in the March month, then in the May month, and then in April month. So you need to organize the task accordingly. In few case note, sometimes we need to start with the latest date, but in a few case note depend on the patient condition or maybe ongoing condition. So we can start with the older date as well. So skill number four, formal letter writing convention. So use of the formal letter writing convention in the professional setting to convey the important information, promotes the clarity, ensure the standardization and aids the understanding. So your writing letter should be in the passive and formal language. So the level of formality and the specific convection used are reflected in, for example, your choice of vocabulary. No need to use any idiom or informal phrases. Sentence structure, it should be in your passive language and complex structure with punctuation. Even candidate needs to avoid the contractions like didn't, doesn't, shouldn't, like this type of format. In case if they want to write, so you will have to write do not, should not, like in this way. And the last one, your skill five, the making a good first impression. So busy healthcare professional value communication that is specific and relevant. Stating the purpose clearly in the opening paragraph of letter gives the reader a quick and precise sense of what is being asked for them. So these are the main five skills you need to improve. Even you need to work on that so that you can get a good score in OET writing task. Okay, then let's begin with, let's start with this next writing task. So today we'll discuss next OET writing task for nurses. So here we have the case note. So in this case note, today's date is mentioned here. Even patient history is given, like Mr. David Taylor, 38-year-old, married, 3 kids, landscape gardener, runs own business, no personal injury insurance, active, enjoy sports, drink 1 to 2 beers a day, more on weekend, past medical history, even they have given here, left inguinal hernia operation. ओके देन सब्जेक्टिव डाटा मीन्स जो आपको पेशेंट एक्सप्लेन कर रहा है, ऑब्जेक्टिव डाटा वट यू हैव ऑब्जर्व. Subjective data, complain of left knee joint pain and swelling, difficulty in strengthening the leg, and has history of twisty left knee joint 6 months ago in the game of tennis, and at that time the joint was painful and swollen and responded to painkiller. So find injury is inhibiting his ability to work productively and worried as need regularly income to support the family and home repayments. So this one your subjective data. Objective has limb slightly swollen and left knee joint, tender spots on the medical aspect of the joint and no effusion. Temperature is normal, blood pressure 120 by 80, pulse rate and investigation done, X-ray knee joint. Okay. Then management, medications given, advice to reduce the smoking, review if no improvement. Again we have some subjective data, but date is different. 25th 8 2010 had experienced the intermittent attack of the pain and swelling. It means कि patient की ये ongoing ही condition है कि first जब patient visit किया था और सेम कंडीशन स्टिल पेशेंट एक्सपीरियंस कर रहा है. लाइक हेयर यू कैन सी कि पेशेंट जो है 6 मंथ अगो, ठीक है, जो भी वो गेम में इन्वॉल्व था, गेम्स ऑफ टेनिस, तो हिस्ट्री है ट्विस्टी की लेफ्ट नी की, but continuously patient is experiencing the same thing, experience intermittent attack of the pain and swelling, and unable to complete all aspect of his work, and as a result uh, income reduce and the reduce smoking cessation 15 per day. Then objective है swelling is there, no effusion, tenderness on the inner aspect of the left knee joint, flexion, extension, impaired range of power, passive and active, then diagnosis is suspected. So that's why they have ordered the MRI scan. Management again they have given. Then patient again visited on the 7/11/2013. Limb still present and patient anxious as has been unable to minimum full-time work. Desperate to resolve as has been unable to maintain the full-time work. Objective data pain, decrease, swelling, no change and no new complication, and MRI report damaged and medical cartilage. मैनेजमेंट में है रेफर टू एन ऑर्थोपेडिक सर्जन डॉक्टर जेम्स ब्राउन टू रिमूव द डैमेज कार्टिलेज इन ऑर्डर टू प्रिवेंट द future osteoporosis, and you have contacted the Dr. Brown receptionist and you have arranged an appointment for Mr. Taylor. Okay, so now we need to check the content. So what they have given here. So today's date, ठीक है, date we can choose from here because today's date is given here, so no need to check another date. And patient history here they have given, एंड पेशेंट की जो ऑन गोइंग कंडीशन है इसमें क्लियरली मेंशन है कि पहले फर्स्ट 8 10 और उस करंट कंडीशन पेशेंट की सेम ही है, मीन्स ऑन गोइंग कंडीशन है. सो व्हाट विल डू हियर, अब पेशेंट की जो आपकी ये 12/8/2010 की कंडीशन है और इवन 25/8/2010, देन 7/11/2010. अब इन 3 इंफॉर्मेशंस को वी नीड टू ब्रीफ इन बॉडी पैराग्राफ 1 बिकॉज अब ये रिसेंट ही फ्रिक्वेंट कंडीशंस हैं, पेशेंट की ऑनगोइंग कंडीशन है. सो ये तीनों जो डेट्स के अकॉर्डिंग वी नीड टू मेक बॉडी पैराग्राफ फर्स्ट एंड द रिमेनिंग पास मेडिकल हिस्ट्री and then your last one, this one your management. So it should be in your planning like this. So here we can start with the date like I have mentioned here. Then after that one line space is there, then one line space के बाद full address we have mentioned here, and full address के बाद again your salutation, one line space, dear Dr. Brown, then patient full detail we have to mention here. Then after giving again one line space, then we have to write first purpose why you are writing this letter. So I am writing to refer Mr. David Taylor into your facility as he requires further orthopedic assessment and management of persistent left knee pain and swallowing following a sport injury. So this one your purpose. Then after writing purpose, then we have to write the body paragraph first because पेशेंट की ongoing condition है तो उस ongoing condition को we can brief it because no need to write each and everything, even we need to eliminate some unnecessary information. So this one your body paragraph first. Mr. Taylor twisted his left knee while playing tennis 6 months ago, and initially the pain and swelling managed with the painkiller. However, he has continued to experience intermittent pain, swelling and difficulty in strengthening the leg. His condition has significantly affected his mobility and ability to work full time. As a result, he remains anxious to resolve the problem, and as per his current condition, limp and persistent swelling and tenderness suggest the problem is still present, current condition of patient. Therefore, magnetic resonance imaging finding confirm the damaged medial cartilage. So this one your body paragraph first because no need to write the unnecessary information. Then this one your body paragraph second, his medical history reveals that he had undergone left inguinal hernia surgery in 2008. Socially is married and he runs own business and he's a smoker and drinker. So whatever information they have given, according to we have to write the letter. Then last one, your discharge plan and management. So in view of the above, it would be highly appreciated if you could provide him further treatment, as he may be required surgical intervention to prevent future osteoporosis, and please arrange an appointment for him at 8 a.m. on 21st 11 2010. Then this one, your last planning. And after writing third body paragraph, again we have to leave one line space. Then your closing statement, please do not hesitate to contact me if you have any queries. Then after your closing statement, again we have to leave one line space in your letter, your in your answer sheet. Then yours sincerely, your sign off. And after writing yours sincerely, again you will have to leave one line space. And because as a registered nurse you are writing this letter, so registered nurse we have to write, because no need to write your name. Maybe in some case note if they have given any specific designation, so accordingly you can write here. So this one your letter, so this one your letter writing for nurses. Okay. Okay, thank you. So in your next live session, then we'll discuss more OET letters. Thank you.